Hi class, and welcome to the second week of Introduction to Healthcare Delivery Systems. So this week we are covering the second chapter in the required textbook titled Beliefs, Values, and Health. Now in this chapter we touch a lot on the area of public health, specifically health promotion and disease prevention. So I've included a link here to provide a little more information for you on what public health is all about. Now I'm going to scroll through this week's content folder and just briefly describe to you the information, materials, and links provided to you for this week. So let's get started. All right, first, here is the PowerPoint presentation that goes along with the assigned reading. And remember, the PowerPoint presentation just really highlights the main points covered in the chapter. However, you do need to take the time to read the chapter. And remember, any questions you have, do not hesitate to email me. Now, below that, I've included here a table that provides you with examples of primary, secondary, and tertiary prevention. So primary prevention seeks to prevent the onset of specific diseases through risk reduction. So usually this entails altering behaviors or exposures that can lead to disease, or by enhancing resistance to the effects of exposure to a disease agent, okay? Now, in the table, as you can see with primary prevention, we're looking at the individual level as well as the population level. So the three examples I have included here is colorectal cancer, infectious diseases like hepatitis C, as well as metabolic syndrome. And it'll, here provides you with what the primary prevention steps would be, the secondary, as well as the tertiary. Now with secondary, this includes procedures that detect and treat preclinical pathological changes and thereby control disease progression. So we're looking more at screening procedures, are usually the first step, or early interventions that are more cost effective than intervening once symptoms occur, okay? And then you have tertiary prevention, which really seeks to soften the impact caused by the disease on the patient's function, longevity, as well as quality of life, okay? So here we're looking at the infectious disease, hepatitis C. When we're looking at secondary prevention, we're looking at screening for hepatitis C on the individual level, as well as on the population level, we're looking at establishing a universal testing system. Now, when we look at tertiary care, we're looking at hepatitis C virus therapy to cure the infection, as well as ensuring close control of high-risk sites, such as tattoo parlors that have been associated with outbreaks. So this will provide a little more clarity, other than knowing the definition of what these three types of prevention are. Here, are some examples to help you understand, have a deeper understanding of what each level of prevention is, as well as looking at the different levels when we're looking at individual and looking at population. And here I have a table for you all that provides examples as well as explanations about the 5 core disciplines in public health. So one of the core disciplines is health promotion and disease prevention, which is a topic covered in this week's assigned reading. So I wanted to make sure that you understand that this is in the area of public health. There are 5 core disciplines. One is biostatistics, which is the application of statistical procedures, techniques, and methodology to identify health trends. So examples in the area of biostatistics would be like a survey statistician or a health data analyst. Another discipline is environmental health science, which is really the area where they focus on identifying and addressing environmental risk factors. And examples of this, of people that work in this area, are ecologists, as well as environmental consultants, and even oceanographers. Now I'm going to scroll a little further down. Third, we have the area of epidemiology, which the area of epidemiology takes into account various hereditary, behavioral, environmental, and healthcare factors. So the area of epidemiology is focused on studying and controlling of disease or injury patterns in human populations. So careers in this field, you'll find communicable disease epidemiologists, as well as a public health officer, or even a health data analyst. Okay, so these examples of careers in this field use the area of epidemiology in their everyday work. Fourth is health service administration and management. So this is where we combine business and science in managing human and fiscal resources needed to deliver effective public health services. So examples in this area would be a director of strategic planning, as well as medical care administrator and gerontology coordinator. So here are some examples. And last but not least is health promotion and disease prevention. So this is where we focus on ways to encourage people to make healthy choices. This includes the development of community-wide education programs that range from promoting healthy lifestyles in order to prevent disease and injury to researching complex health issues. So some careers that are found in the area of health promotion and disease prevention include a health education program coordinator, a school health educator, as well as behavior scientist. All right. Again, if you have any questions, be sure to email me. Now I'm going to scroll a little further down. We have the epidemiology model here. So it is composed of three primary components. One is your host, right here on the top. And this is the organism harboring the disease. So it's the who of the triangle, okay? We have the agent, which is the microbe that causes the disease. So it is the what part of the triangle. And then last is the environment. So this is looking at the external factors that cause or allow this disease to be transmitted or contracted to another host. All right. I also included a couple of pointers here. What I liked about this specific diagram, and the reason I included it, is again, it includes examples of each component of this triangle. And here I also touch on what an outbreak or an epidemic is, as well as what an endemic is. I wanted you guys to understand the difference between the two. So below the epidemiologic triangle information that I have above is a great video which really touches on this specific triangle and how epidemiologists do the utmost to try to contain the spread of a disease. So this video here was created by the CDC, or Centers for Disease Control and Prevention, and it really highlights the importance of maintaining surveillance indicators to prevent the spread of infectious diseases, especially in densely populated urban slums where sanitation may be suboptimal, and emerging diseases could spread rapidly from person to person within the slum and also to neighboring communities. So this video is very short. It's about 5 minutes, but it'll really help you understand the three components of the epidemiology triangle, and how it is very important to try to stop the transmission of outbreaks of a disease, just to try to contain it. All right, now below that, I have a video that touches on what public health is all about. Be sure to watch it. And below that, here is just a table that you guys have in your assigned textbook. It's on page 53. And it really just touches on the four major inputs that contribute to health and well-being, which is environment, lifestyle, heredity, and medical care. And what I like about this paradigm, this diagram by Bloom, which was actually proposed back in 1974, is it really provides you, other than with just the four major inputs that contribute to health and well-being, it also includes examples to help you really understand all the factors that affect a person's health. Okay? Now, to go along or to touch on this topic of determinants of health, I'm going to scroll a little further down to this very impactful TED Talk. It's about 8 to 10 minutes, and it talks about the determinants of health. Now, remember, determinants of health are major factors that over time affect health and well-being of individuals and populations. So in this video, you have Dr. Pomeroy, who talks about what social determinants of health are and how they impact one's health. Okay? And then again, below that is another video that touches on the same topic of determinants of health. And then here is another video, and this talks about the Healthy People Initiative, specifically about the Healthy People 2020. And it's very short, and it just touches on the topic of the Healthy People Initiative, as well as the objectives of Healthy People 2020. Last is our weekly checklist. Be sure to complete everything on this list before going on to the following week. If you have any questions at all, do not hesitate to email me, contact me. That's what I'm here for. You can even text me. All right? Take care, everyone, and good luck.